All right, so this is class 4 of the pain management class. This is going to be good. You're going to really learn some stuff, be introduced to some stuff that's really changed my practice over the years. It's really helped me get a lot better results when I started working with the channels more specifically. So today's goals are going to be for today to just be given the basic introduction to differentiating between the various primary channel strategies, okay, as well as how to assess when to apply each strategy. So you get some rough guidelines about how do I choose whether to do this or that. You're going to learn the basics of a channel balancing strategy that's commonly called the balance method, that was popularized by Dr. Tan. Maybe some of you already know this. I don't know. Show of hands. Who here has learned the balance method? One.
We learned it a little bit.
Huh? A little bit?
We learned it a little bit, yeah.
Naz, Carol, did you guys learn it at all?
I agree with Teresa. Like I don't remember it.
It was in Celeste's class last trimester, right. I think. We touched on it.
Yeah. So I don't really so much anymore, but around 2010, I started teaching a little basic course on how to apply the balance method to 5-element acupuncture and to use it not just for treatment, but also to refine and support your diagnosis, as well as provide insight into the patient's deeper spirit level issues. Now, I don't know if that was something that Dr. Tan ever considered. You know, I wasn't real close to him. I went to like a lot of his workshops starting in like 2000. And when he was kind of like outside the classroom, really all he wanted to do was drink and tell jokes, and he didn't really want to teach. So I would occasionally try to talk to him about this, and he just kind of nodded. He said, "Yeah, that's nice." So I think if I was like off base, he probably would have said something, because he didn't really, you know, I'm sure he wouldn't allow anyone to like remain in any kind of state of confusion or misunderstanding. But this can really change your practice by involving the channels in a way that actually helps support the CF treatments and helps you to broker conversation, even begin conversations with your patients, you know, to sort of open the door to a deeper level conversation that might be hard to segue for patients who don't really know anything about the 5 elements and things like that. All right, so we're going to be talking about we're going to be going over in a little bit of detail about some few channel strategies, channel treatment strategies. And we're going to talk a little bit about extra points, right? And really looking at this as tools that you can then infuse into or insert into the treatments for the various conditions, which we'll begin discussing, I believe, next week in class 5. We'll be starting with the head and the neck, right? But I wanted to start with the original, like the sort of the basic theory first, so you have that as a foundation that you can then take and learn how to step by step apply to, you know, your patients when they're dealing with certain conditions affecting various areas of the body. We'll start with the head and the neck, and we'll work our way down. All right. So your goals. Yes.
Sorry, are you going to speak today from a specific set of notes? I don't see one, like a lecture long set of notes.
I didn't put lecture notes, but I will be doing. I will be going through the PowerPoint for the balance method.
Okay, thank you.
I think it's called the balance method PP 2020,
Mm-hmm.
right?
Yep.
We'll be going over that, and then I do have notes written. If you want, I can post them really fast.
It does help, because there's so much content that I don't have to worry about capturing all of it, and I can listen better if I have yours to follow along with. Thank you.
Let me just post that right now for you in class 4 module. Like these notes aren't super structured, so, but I'll put them up there anyway to give you something to work with. All right, class 4. All right, I think it's listed as class 3 outline, but it should be class 4 outline, so I'll change the name. All right, let me just change the name so it won't confuse you. Okay, there you go. It's at the very bottom of the class 4 module. Okay. So you can use that. So again, the goals for today, I'm just introducing you to briefly going over some channel treatment strategies. So one of the goals is to be introduced to those and to get the basics of how to differentiate, when you would use this versus that. Assess when to apply each strategy, and you'll learn the basics of the channel balancing strategy known as the balance method, and see it not just as a form of treatment, but also something that can assist you in your diagnosis, as well as support you in your deeper level conversations with your patients about their spirit level issues. And then we're also going to talk a little bit about motor extra points. Okay, excuse me. I had a lot of juice this morning, and now I'm all stuffed up. It's weird. By the way, I don't know if you guys have ever tried like celery juice. I've been doing that. I heard from somebody who told me about this medical medium, and I looked it up. And basically, he has you drink like 16 ounces of celery juice every morning on an empty stomach, and it leaches out a lot of toxins. And I have to say, it's made a big difference in how I feel and how I look. So highly recommend it, by the way. Anybody ever try it? But then I just had some cereal and it stuffed me up. So it's a weird day. So anyway, so pardon my nasally voice. All right, so there's a number of different channel strategies. Some of you are already familiar with a number of them. So what I'm calling like channel clearing is basically clearing exit entry blocks, but also using the entry point and the exit point within one meridian, within one channel, to help move qi through that channel, to move out, to break any stagnation, any blockage in that channel. So what can block a channel? Certainly the pathogenic factors can block a channel, right? An invasion of cold, heat, right? Heat is generally something, though, that forms over time, unless you live in a very hot climate, which most of us don't experience here. But if you're living like closer to the equator, where there's a lot of heat, a lot of damp heat, that type of environment can block the channels, as well as trauma can certainly create a channel level blockage, right? Some kind of impact trauma where the micro blood vessels and maybe even some of the larger blood vessels have broken and they're spilling blood, and the contents, intracellular contents of the tissues into the local area. That can certainly block a channel. Certainly the emotions can stagnate the qi, right? So in that case, bleeding is sometimes really good along the channel, as well as in addition to the exit and entry points. So a common point to bleed would be the luo point, the junction point, right? You can also plum blossom it, right? So that's another way of treating the point, and also not just the luo point, but if you're palpating along a channel and the channel feels like a lot of differences in temperature, like you're going along and it feels pretty normal, but then all of a sudden part of that channel feels cold, you can certainly cup that area, you can massage the area, you can plum blossom the area. Of course, you can moxa the area, right? Either direct or indirect moxa on the needle, right? Into that area of cold to disperse the cold. So what I found is doing the entry point and the exit point is really helpful a lot of times when the patient is feeling like pain or any type of discomfort that's extremely localized, and you've palpated along the area and you feel differences and changes in either the temperature or the tonicity. By tonicity, I mean, is it overly yielding compared to the tissue in the neighborhood? Is it hard and resistant? Is there a lot of hachure there, like the patient is very sensitive to points that you're palpating along the area? Or it just feels different in terms of like moisture level or temperature or tonicity? Or maybe you're feeling a lot of like nodules and papules, like, like anything that's like as small as like tapioca, which Kiko Matsumoto used to call gummies, right? These like little phlegm nodules, or they might be substantially larger, or maybe even muscle knots, right? So you would do the entry point, the exit point, and then you would do points along the channel that you've already palpated and marked out to either moxa or needle in different ways. In the 7th trimester, if you remember the Hagu needling, where you go in and then kind of back out, but not all the way out of the skin, then you redirect the needle in and redirect the needle in and redirect the needle in and then in, right? You remember all that? The Hagu needling, right? So that the Hagutsu is a way of treating ashi points or like maybe knots or nodules in the area, right? That are created by cold and damp that's accumulated, or maybe even blood stagnation, right? So how you decide when to use that, there's a couple of ways of deciding, when I'm going to choose to do the entry point and the exit point. Of course, the most obvious is when you're feeling the pulses, that official or element feels very deficient or very excessive compared to all the other ones, right? So it's like that one like really stands out on the pulse. I don't really use the tongue for that. And then I would go back and palpate that area, double check there might be an exit entry block. So a lot of the times that I do that entry and exit points on these, there usually is an exit entry block or something that feels close to it, right? And so that can be really helpful. So that's one way of looking at it. Another way is simply when you're going inside and you're asking for guidance, which I would recommend that you do, and then back it up with data, right? So if you get like the hit that like, oh yeah, like I'm meditating on this patient, I'm opening my heart to them, and this is what I'm seeing, or I'm getting some insight, from within, or maybe you hear guidance, however you get it, right? Or an inner knowing, right? Then follow it up with a test, like, palpate the area, palpate the channel, re-feel the pulses, feel them again. Does it seem like there's an exit entry block? Or potentially, like, is this sort of the edge of the wedge of maybe like what we're in the beginning stages of what could develop into an exit entry block? Like, what's your gut sense about that? So, back up your hunches, back up your intuition, your guidance with phenomena. That's a nice way of refining your intuition. Okay. So that's generally the way I either tune in, or I feel an exit entry block on the pulses, or one official or element feels very different than all the others. I will tell you that Bob Duggan taught us something that Worsley supposedly taught, but I never heard him say it, was that if one of the pulse positions feels wildly different than all the rest, then you would do the source points on those officials. So for example, let's say somebody comes in with shoulder pain, and you notice on the pulses that metal feels like really different, maybe like really deficient compared to, heart, compared to, which is on the upper jowl, right? Compared to maybe say spleen and stomach, which is right next door, maybe compared to 5 and 6, which is on the same side, right? Maybe, what would you say, like wood feels different than wood, which precedes it on the meridian clock cycle, right? So maybe that feels really different. Now, what Duggan taught us, apparently that Worsley said, was in that first instance, you would treat the source point on those officials. So you would do like lung 9 and large intestine 4. And that can be very helpful. Like you're giving a boost to that official and kind of bringing it back into the fold. You're kind of like, supporting the yuan qi, kind of restoring it back to its original nature, and hopefully that will change it. I have found that it does sometimes, but more when there's more of like an organ level issue or like a mental spirit level issue that's been chronic and affecting the function of the official. More often than not, I found that the entry exit points strategy, which you can combine with the next entry point after that one, is better. So like, let's say you feel it on both metal officials. I would do, lung 1, then I would do the exit point on lung, and then I would do the entry point on large intestine, then I would do the exit point on large intestine. And then, if it still didn't seem to be like integrating much with, with the stomach, right, then I might do stomach 1 and stomach 45, just to kind of pull it all the way through. But more often than not, just the entry exit points for that official or those officials, especially along where there's pain, patient complains like anterior shoulder pain, I'm thinking lung, or lower down pericardium, like more towards the axilla, or axillary fold, right? So, I might do lung 1, right? And then the exit point on lung, and then maybe the entry exit on large intestine, just as its yang complement. And then I would go back and then palpate, have the patient move around, test it out. Does it feel the same? Is there better range of motion? Feel the pulse. Does the pulse improve? Okay. Does that make sense? So that's the what and the how and the why. Right? There's pain, there's discomfort, there's inability, there's like an inhibited range of motion maybe without pain. A lot of times frozen shoulder doesn't hurt. They just can't move they just can't lift their arm above their shoulder. So, check the pulses. Does one feel very different than the rest in terms of maybe either deficient and empty or full and overflowing? Palpate along the area, right? Mark out some Usher points, mark out points that feel, unusual to you based on tonicity, temperature, moisture level, maybe color. Maybe your visual acuity is so great that you can really see like fine distinctions in the color. Great. And then you would do the entry point, and then points along the area. Maybe you could also do points above and below the area of pain, and then the exit point. And then you can add in other points like the low point or even the G clef point, which is very good, right? Does that make sense? Any questions about that? Have you guys ever done that? Like done a channel clearing treatment?
Yes, and thinking more, I think of Ashir points and then entry and exit, not so much as methodical as what you just went through. That's super helpful.
Right. Okay, good. So that actually brings me to the next one, which is, I'm going to skip local middle distal and I'll come back to that. So I'm going to go to channel harmonizing. That term is a term I made up because I couldn't find any other term in any other book that gave this a name other than shoestring point combination. But it's like, well, what is this doing? What is the shoestring point doing? I think it's sort of a subset of channel clearing. In the Ling Shu and the Su Wen, it talks about how shoestring points, and the Nanjing, the shoestring points are good for clearing, minor obstacles to the flow of qi through the channel. Because we always think of G cleft, and G clefts are great for clearing a blockage. And G clefts are really good for acute situations. They're also good for chronic situations. In most texts, they talk about G clefts in terms of acute. And then more shoestring point would be more chronic. I don't really break it up that way so much. I think they're both indicated for both. And again, palpation is kind of like my go-to uh, phenomena to guide my assessment, as well as going inside and asking for guidance. But generally, if it's kind of like a mild pain, it's not like super severe. Again, as the chi goes from the Jingwell point to the Hussey point, right? As it moves proximally, in the more Taoist way of looking at things, which is not numbered, but just names, and then they work in a certain order from extremities to center. The Jingwell is like, just like this thin, powerful stream, right? Bubbling out of the ground, shooting forward with great velocity and vigor, but not much width, not much breadth. So it really can't carry anything along. It's more like, emerging powerfully, right? And then, the Ying Spring point is still like, a very thin stream. It's not even a stream yet, right? It's a spring, right? So the width and the breadth of it is still narrow. So it's good for clearing things that are more ephemeral, like heat, right? It's good for more venting, right? The Jingwell and the Ying Spring, they are in the 5, right? So you've got the 2 that are relatively exterior. Then you've got the Shoestring point, which is the fulcrum between exterior and interior. Then you got the Jing River and Hussey. So these are more internal, right? So the Shoestring point is like a fulcrum. So like, the Ying Spring and Jingwell, they're more for like venting things out, allowing things to escape, opening the door and allowing things, these things that are building up, especially like full exterior conditions. That's why these are clinically indicated for exterior and full conditions, is there's so much pressure building up in the channel. You open the window, then open the door, to let all this hot wind or, cold wind out, right? The Shoestring point, this is where like dampness starts to emerge in terms of like the progression of problems, right? It's not just like some exterior pathogenic factor. Now things are starting to take root. It's on the fulcrum between interior and exterior. So the Shoestring points are often indicated for problems in the joints. Why is that? Because the Shoestring point now has enough width and breadth and power to move stuff, right? To move the silt and the debris and the leaves that's building up in the river. And for the human, that would be like damp. And interestingly enough, most of the time, these points are earth on the yin, right? Or wood on the yang, right? So, these are good for dealing with a lot of damp and moving things through the channel that are kind of like minor obstructions. So this is called the Shoestring point combination. I call it channel harmonizing. For one thing is I often combine it with the low point, the junction point, which deals with the transverse low, and that's also very harmonizing, right? That's why we use them for akabanis. We're harmonizing left and right and harmonizing interior and exterior, right? So the Shoestring, so what you would do is like, say somebody has like elbow pain, right? I've hurt my elbow, I've banged it, it's sore around large intestine 11 area, maybe even into like the triple heater, like lateral epicondyle, right? So what I can do is on the affected side, like let's say it hurt, I'm palpating along and large intestine is the more painful of the two. So I go for that first, right? Go for the low hanging fruit first. So I would treat the Shoestring point of the damaged or injured or involved meridian, which in this case is the large intestine. So I would do the Shoestring point on the affected side. So that's large intestine 3, right? And you can put it in even or you can tonify it, right? And again, all the Shoestring points on the hands are done with a loose fist. All the Shoestring points on the hand, the yang ones, small intestine 3, triple heater 3, large intestine 3, loose fist. So let's say it's the left elbow, large intestine. So I do the shoestring point on large intestine on the affected side. And large intestine, which of the 6 divisions is large intestine in?
Yang Ming.
Yang Ming, hand Yang Ming. So I would do the shoestring point on the foot Yang Ming on the opposite side. So large intestine 3 on the left, stomach 43 on the right. Right? So if I have like an injured thumb, right? And I'm looking, I'm palpating around and they say, yeah, it really hurts like in this joint here. And you kind of say, well, yeah, this is kind of like the lung meridian, right? So I would do the shoestring point on the affected side, which is lung 9. Lung is hand tai yin. So I would do the shoestring point on the foot tai yin on the opposite side. In this case, that would be spleen 3 on the left. If I've got shoulder pain around the triple heater on the right side, right around triple heater 14 or so, right? Maybe even just below that into like the teres minor, which actually on me is a little bit sore, right? So right side triple heater is hand Xiao Yang. So I would do triple heater 3 on the affected side. And then I would do it 6th division complement, foot Xiao Yang, gallbladder, shoestring point, gallbladder 41 on the opposite side, left. And I would put these in, even or tonified, and I'd leave them in about 15 minutes, maybe even 30 minutes. All right. So let's say somebody has hip pain on their left side on the lateral aspect of the hip, right in that joint. Which 2 points would I do? Lateral left hip pain. So what's the first step? The first step is what meridian goes through the area that hurts. So what meridian is on the lateral side of the hip?
Gallbladder.
Gallbladder. So what point would I do on gallbladder and which side? I got left hip pain.
Gallbladder 41.
On the
Left side.
On the left, yep, okay. So gallbladder is foot Xiao Yang. So what would I do next?
Triple Energizer 3 on the right.
Exactly right, exactly right. Let's say I've got posterior knee pain right in the knee crease, right in the popliteal crease, on the posterior side, on the right. What 2 points would I do?
Kidney 3 on the
Let's say
right.
it's right in the center. Let's say it's right in the center, not off to the side.
Okay, so bladder.
Mhm.
Bladder 65, and then on that right side, and
Yep.
then small intestine 3 on the left.
Exactly right. Exactly right. So let's say I've sprained my ankle on the medial aspect of my left ankle, and you notice it's really palpable and painful along the spleen and kidney channels on my left ankle. What 4 points would I do?
Now you would do kidney 3
Yes.
and heart 7 as
Yes.
the Xiao Yin pair.
Yep.
And then for
so the other one was spleen.
so that spleen is tie-in.
Yes.
So then that's going to be spleen 3 and lung 9.
Yes. So if I injured my left ankle, which side points would I do?
You would do the kidney 3 and the spleen 3 on the injured side, and then on the opposite side would be the heart 7 and the lung 9.
Fantastic. All right. Very good. Outstanding. So what this does is, you know, a lot of this, and we'll get to this when we get to the balance method too, in a number of chapters in the Su Wen and at least 3 chapters in the Ling Shu, they talk about if the problem is in the upper portion of the body, you treat the lower. If the problem is on the front, you treat the back. If the problem is on the left, you treat the right. That's where all this comes from, right? You're walking down the street. When you get up out of your chair and you start walking down the street, when your left foot goes forward, which hand goes forward? You're right.
You're right.
Yeah. Always balance, right? So that's the channel harmonizing. And what I often do, this is for me, especially if there's like cold stagnation, maybe some blood stagnation that I suspect is involved because there's a choppy pulse, maybe the tongue looks a little purplish, maybe the type of pain they describe, you know, like briefly ever so often it's like a sharp pain or a gripping pain or like a cramping type pain, then I'll include the low point. So to me, you don't have to do that, but I often do. I mean, don't just you know, go ahead and do it. You know, you want to palpate the points and check into what the type of pain is and things like that. But oftentimes the shoestring point combination is very helpful unto itself, and a lot of times I'll combine it with the low point. All right. Any questions about those two? Channel clearing, channel harmonizing. All right. Why don't we take a break until 20 of, like a 6-minute break? Is that okay? Just a real short break, and then we'll come back. All right, so for local middle distal, I actually learned it originally as local distal, and then I think some other texts talk about it as local middle distal, which means you're doing a point close to the area where there's been some kind of trauma or pain. So you're doing it in the very close vicinity. And then you're doing a distal point like much further away, either on the same channel or a different channel, to kind of guide and balance the qi, as well as a point sort of like between the two that's relatively adjacent, but could, you know, be quite far away as well, depending on where the distal point is, right? So it doesn't have to be like exactly in the middle. It's just somewhere between. And these are basically points to move the qi and blood and circulate the qi and blood through the local area, wherever the pain is, wherever the problem is. And then a point like somewhat nearby, which has an effect on your desired effect on the qi. So that might be to help move a blockage like a G clef point. It might be help to circulate blood or to invigorate the blood and support the circulation like the low point, right? It could be ashi points. It could be a different type of point, like a He point, for example, because maybe there's like heat toxins involved and you've sprained the wrist, and so you do large intestine 11 and 15 to clear out heat and heat toxins, right, from the area. And then finally, like a distal point, which stimulates either a direction of movement or relates to the area, which you'll learn later. Like, so morphology treats morphology, tissue treats tissue. So for example, if I have like a wrist injury, I might treat a point on the opposite ankle, right? Or I might treat a point on the shoulder joint because those two joints relate to each other, which you'll learn later in a little bit today. Or it might affect a certain substance or a certain tissue, or it might stimulate the nature of healing, right? So a lot of times it's like dealing with an external pathogenic factor, right? Or some kind of substance more often than not, okay? So maybe you've injured a shoulder or your neck, maybe you tweaked your neck and like that radiates down into the shoulder. You know, a distal point might be like, say, a Jingwell point or a Yin spring point or a shoestring point, right? So those are like examples of distal points, right? So sometimes the distal points are in the extremities and sometimes the distal points are maybe on the torso or the neck or the head, right? Exit points are considered like, you know, you have an issue like an adjacent point or a middle point might be like say the entry point, and then the distal point might be the exit point. I don't use this a lot. Like Machocha he talks about it a lot in his book called Channels of Acupuncture. Is that right? Let's see. Yeah, Channels of Acupuncture. It's that sort of like bronzy, coppery looking textbook. It's a really good book. And he goes into like extraordinary detail about local middle distal points and based on the functional nature of the points, right? You know, just like you learned in the point functions class, right? So like, let's say I have like a wrist injury, you know, a local point might be like a point in the area, right? Like maybe in the area that's sore. A middle point or adjacent point might be like the Jingwell point, right? To release like the stagnant blood from the trauma and invigorate the sinews and collaterals. And then a distal point might be like, say, if it's on the triple heater, it might be like triple heater 14, right? Because that helps to like, you know, clear toxins out of the channel, right? John, did you have a question? No? Okay. So I'm not going into like great detail about the local middle distal. There's other textbooks you can read about it, but just know that it's really good for treating channel level issues that generally involve either some kind of trauma or some kind of B syndrome, which involves cold and damp and wind, or heat and damp and wind, some combination of those three, where one might be predominant. So trauma, B syndrome, you know, chronic pathogenic factor issues like, you know, rheumatic arthritis, right? Rheumatoid arthritis, or very chronic osteoarthritis where the cold is developed into heat and, you know, you've got these like really gnarly knuckles, or just any kind of pain really. You can do local middle distal. Again, I didn't want to like go like way into it, but it's basically just based on point functions. You know, how does this point affect an external pathogenic factor? What substances and how does it deal with these substances? So is it like invigorating blood? Is it moving chi, right? Things like that, right? And then a distal point would be some functional point that either relates to that area of the body based on morphology, right? Toes treat fingers and vice versa. Ankles treat wrists. Elbows treat knees. Shoulders treat hips. You're going to learn more about this. So there might be some morphological resonance to the distal point. There might be some functional resonance to the point in terms of like how it deals with pathogenic factors, how it deals with the movement of chi. Maybe even empirical point, like stomach 38 is an empirical point for shoulder pain, right?
Time.
Yeah.
Sorry, I got a little lost in this section. Could you repeat what you said a moment ago? Or actually, let me repeat what I think I heard and you can correct me. Local point is pain based, right? You choose the point based on the pain.
Yeah, close to or at the pain.
Okay. So it can be an official point. I mean, by official, like a point we recognize, or it can be an Ashi point.
Technically, I think in the most basic way, it can include an Ashi point, but I think that like in the main discussions that I've seen in texts, they're talking about an actual named and numbered point.
Okay. And then the
Which might be
middle
a point, but it's still like an actual point.
Okay. Okay. And then from the middle and distal points, those are based on point function?
Yeah.
You choose those based on point function.
Yeah.
Okay. Thank you.
And you can choose the local point based on point function too. Yeah.
Okay. If you get lucky.
Yeah.
Okay. Thank you.
Yeah. Again, it's not a strategy like I do a lot. I think, you know, there's a lot more 5-element like acupuncturists that do it based on like staying within the official, especially people who are like CF acupuncturists, where they just don't treat hardly any points other than the CF meridians, other than like back shu and outer bladder and upper kidney, and maybe a couple other like CVGV. Right? I mean, you know, a distal point could be a CVGV point too, right? Or if you have abdominal fullness and pain, right? You know, CV points could be like a local point. By the way, for local points, you can pick more than one. For the middle and distal, I would just pick like one. I mean, you can do a couple of each, but I would try and do as few as possible. Okay. We might talk a little bit more local, middle, distal examples when we talk about the different body areas that we're treating. So I'll get into a little bit more detail then. I just wanted to give you the concept right now. All right. You guys know about Akabanis, of course, right? So this is balancing the Jing and the Lo using the Luo points. There's actually a little pamphlet. I think it's available at the library about written by Dr. Akabani on his use of Akabani points, and he actually treats the AEPs. So, or and diagnoses it at the AEP. So it's like very interesting. But just for now, know that Akapani is a really fantastic strategy for any type of physical, or I would say also emotional pain that the patient is dealing with that makes them sort of off balance. So it's often one-sided. You know, if somebody's got like a headache that kind of covers like the whole front of the head, I mean, you can test the Akabanis just to see what happens, but more often than not, it's not that kind of discomfort. It's more like one-sided pain where like there's a disconnect between the left and the right, or even above and below in terms of use of Akabanis. So that's a nice channel balancing, channel rectifying treatment that involves the Luo points and the source points. You know, it's funny, like I would love to come up with this like grand formula for like when to use Akabanis and when they're useful and when they're not. And, you know, there's some different theories out there, but in my practice, it's so hit or miss. But when it hits so well and is so effective that I'm remiss not to do it, you know? So I would say like 6 or 7 times out of 10, it gets great results. But then the other 3 or 4 times, it's like, meh. And it's funny because like I've looked at, well, is it about the, like, well, maybe it's like, it doesn't work so much for sinew meridian, you know, that are problems that are like primarily involving the sinew meridians, or, you know, but it does sometimes and does not other times. Is it just like a primary channel of like this type of pain versus that type of pain? Haven't been able to make any particular association or differentiation. I don't know. Like when you guys work with Celeste, did she ever give you any kind of insight into that? Like, this is when you use it, and this is when it's effective, and this is when you don't use it, and this is when it's not effective?
Not from my experience. She talks about it a lot as a channel level
Yeah.
treatment. So that was a big refocus from how it was introduced from the 5-element perspective. But so it really, you're still going through your same diagnostic assessment process. You're assessing the channels, primary channels, assessing the sinew channels, and then you're using your gut intuition to figure out, well, maybe this is the right time to do it, as opposed to starting with a sinew treatment or a primary channel treatment.
I mean, I often start because it's like, you know, you're there, you've done the assessment. So like, why not just treat what's off? What's the worst that can happen? I mean, their pain isn't any better, but now all their channels, or primary channels, are balanced. Well, there's no downside to that. So what the heck? So it's just one of those things like AE, I just do it. And what I would say is it's not a one and done thing. So if you do find that it is successful, like you've assessed it, you've got some off, you've treated them in the way you've learned to treat them, they balance, the patient feels better, I check it the next time. And if any of them are off, I treat them again. This is not a one and done, right? Just recently I had this lady, I had to do AE on her like 3 visits in a row. You know, it was like, wow, it's been like an hour and a half and I really need to, I need the room now. So we're done. I mean, but you know, you think, well, they've lived this long with more AE, so sending them home with less is not bad. You know what I mean? Like if they're 70% better, you know, I don't feel bad about sending somebody home in that state. But Akabanis, I had to treat Akabanis like 2 or 3 times before it would stick. So just remember, that's a big thing. I don't know if you get taught that. Yeah.
Sorry to interrupt. We watched one time a demo. I think it was Linda doing a patient way back when. She did Akabanis on the patient's feet because the patient said, I don't know, my feet are cold all the time. I can't feel them. Yeah. And so she did this, and it seemed like just the introduction of the warmth to all those Jing Wells.
Yeah.
I don't even know that she was out of balance necessarily, but do you find that if patients are cold or their extremities are cold, that Akabanis it helps them to wake that area up?
It could, because you're stimulating the Jing Well point with heat, right? So it's like indirect moxa in a way.
Yeah.
And also the, you know, Jing Wells are outstanding and indicated for expelling external pathogenic factors, most importantly, wind and cold, but heat as well, especially if you bleed it. So, you know, there's that. And then there's also just, what was I going to say? Yeah, like, you know, I don't test the Akabanis if somebody has like a lot of exuberant heat signs and red flags around that area, then I just leave it be. Or if they've got a lot of like neuropathy, like foot peripheral neuropathy, I don't test the Akabanis.
Time.
Yeah.
Do you ever, because like spleen 21 is the sort of master low point. Do you ever cheat? And I say the word cheat, but
no, I get it.
Do you ever use that as a reset?
You know, I heard about this when I was in school, and I don't think I've ever gotten that to work. Or maybe I just haven't had a patient where that would be useful for, because it is the great low, but it's also like the great low of the chest. You know, it's not the great low of the lower body. So I've had patients, you know, students in clinic, they do it. And I'm like, and I won't say no, because it's based on sound thinking. So I'm like, okay, yeah, sure. I mean, you've heard this, it's a theory, let's try it out. And it worked great. I've never had it work for me. That's not to say that it doesn't work. It's just, you know, like, let's say they got like, you know, 8 of the 12 Akabanis off. Sure, give it a shot. What the hell?
Okay, thank you.
Yeah. So when I choose Akabani's, Dr. Akabani himself said, what has the greatest numerical disparity? Right? So he didn't care what the patient's CF was. He didn't care where the pain was. He didn't care which organ was in dysfunction. Whichever one had the greatest numerical disparity between left and right is where he would start. And that's kind of like my rule as well. Unless I get some gut sense that says, you know, actually, this might be their CF. Let's try that. Or, you know, this one that's off goes through the area of pain. Let's try that. So, you know, these are just things to think about when you choose. Okay. Any questions about that? All right, before we get into the balance method, I just want to talk briefly about some extra points. So there's a bunch of empirical points that have been found to be effective over the millennia, just based on people's observations and experimentation, and probably grounded in some aspect of theory that either is maybe somewhat obscure or has become become extinct because, you know, like books were burned and scrolls were lost. Like stomach 38 is really like a well-known point for shoulder pain on the opposite side, especially involving the large intestine, which makes sense because it's its Yang-Ming partner. Or, you know, like large intestine 4 is good for like toothache because it's like one of the 4 command points of the body, which is the command point of the face and head, right? So, you know, like middle of man or middle of human, right? GV26 is like an empirical point for back pain that's worse upon torso flexion, right? Bending over. So different things like that. You'll come across and learn. Okay. This is why it's helpful every now and then just to kind of like read through Deadman or some other text about point functions, because every now and then you stumble across like an empirical point, which is really useful. Like for me, small intestine 18, which is also the gathering point for the 3-leg yang sinew meridians, is also an empirical point for almost every kind of back pain. And I'll tell you, it's tremendously effective. Similarly, Sancha, right? This one here, right? So, you know, you would needle it, right? In that way, right? Take like an inch or inch and a half needle, guide it, sort of like opposite of like triple heater 3, right? Into this way, is a phenomenal point for anything involving the PSIS, posterior superior iliac spine, the sacrum, the very low back, the ischial tuberosity, right? Sacral pain, SI joint pain. There's reasons why, but especially with like Korean hand acupuncture, this relates a lot to the low back and the spine and the sacrum. And so that's like a empirical point, like Yao Tong Zhui. You guys have heard about these two right here, right? Those are empirical points for low back pain, right? Because in the Koryo hand acupuncture, here's the sacrum, right here. And so it's just above that, right in the lumbar region, right? L4, L5. Here's the sacrum. Here's the low back, the lumbar region. Okay, does that make sense? So those are some empirical points, just to know that there are them. And what I generally do is when I treat empirical points, if I'm doing it as part of a larger channel-based strategy, I'll do the channel points first, then the empirical points. You can have them in at the same time, or you can put them in at a different time. But I generally, more often than not, include these points as the last points I would include in a set of points. And when I say a set of points, like, okay, I'm putting these in for 15, 30 minutes, and then I'm leaving the room or doing a guided meditation, or while the points are in, I might be doing some manual manipulation, massage or whatever, or we might be doing some guided meditation or something like that, right? So that's one set of points. And then I might take those out and then do like another set. Like say, if you wanted to end on the CF, that would be an example of that. Okay. So motor points. So motor point is basically where I believe is like the largest nerve enters into the muscle belly of that muscle, right? They're highly electrically conductive. Yes, John. You had a question?
It says CMC handout page 8 and 9.
Yeah, that was for me. So I put a little A next to it. So if you look down below the capital B, you'll see a motor point is.
Oh, that's related to, okay.
Yeah, sorry, the MC handout, that was like my note to myself to look at page 8 and 9 of my notes. Yeah, just ignore that. So I've defined a motor point for you there, right?
When you go into the different body areas, you'll talk more. This is just sort of an introduction again.
Yep, you're just learning what a motor point is.
Thank you.
Then when we talk about, like, say, the neck or the shoulder, right, or the elbow, like, we're going to be talking about the involvement of different muscles. And this is one way of treating to affect the musculature that's affecting a certain area of the body.
You're just doing a foundation today.
This is just the foundation thing. Like, this is what a motor point is. And then we're going to talk about how you would apply that in treatment later. But the basics of what it is it's supposedly where, like, the largest nerve bundle enters a muscle, usually around the muscle belly or some portion of, like, the thicker muscle, that represents some neuromuscular junction or, like, intense zone of like a more highly dense innervation, right? And what you'll notice is that often this muscle can be stimulated with electrical stimulation, or motor point, manual stimulation with the needle, or you can even do moxa on the needle. And you'll notice, like, when you really, like, get into that muscle belly, there'll be what's called a fasciculation or a twitch, where the whole area doesn't twitch, but just that little area. All right. And these are said to have, like, a great deal of electrical conductivity, which makes sense because it's where the largest aspect of now, you're not needling into the nerve, so don't worry about that. And it's not painful, but people will feel it, and you'll be able to see it sometimes. You'll see it twitch. All right. So these are points that help a muscle to relax or a muscle to get stronger. So the reason you do these points is you would help relax an overactive muscle that's in spasms, that's contracted, that's shortened and overly tight. You would help that to relax. Likewise, a muscle might be overly lengthened and therefore weak and what's called inhibited. Inhibited means it's inhibited from contraction. Like, it's like the message has been interfered with from the spinal cord and the brain, the central nervous system, to activate. So it's inhibited, it's hesitant, it can't act, it can't contract, right? So that's a deficiency, right? The other's an excess. Does this make sense? So those are the two reasons you would do a muscle point. It's either overactive and shortened and overly tight and needs to relax, or it's been overly lengthened, it's weak and inhibited from firing. And so you do that to strengthen it and to enhance that communication between the muscle and the central nervous system. Okay? And there's different ways of treating it, and we'll talk about how to do that. But the easiest way is with like just like maybe a little bit of very gentle lift and thrust till you get the needle to fasciculate, then you leave it alone for a few minutes, or you can take it right out, or you can put it in, very gently stimulate it, and then connect it to an e-stim machine. And we'll go over that later too, right? Or you can use what's called a Pointer Plus, which is basically like sort of like a long device, maybe about like a foot long, and it's like sort of like almost like a glorified drafting pencil, and it has a metal tip, and you turn it on and you just zap it. You just zap the needle and you'll see the muscle fasciculate. Yeah, it's very gentle and people like it. People don't go, oh, you know, it's just like, oh, I felt that. You know, it's fine. You're not electrocuting them. This is microcurrent. You know, it's not hooking them up to a car battery. Yeah, right. Yeah, you shouldn't see any sparks. All right, let me talk about trigger points really quickly, and then we'll take a short break. So a trigger point, this is from Travell. There's a book, 2 books actually. It's got one on the upper body and one on the lower body. It's called Myofascial Pain and Dysfunction, the Trigger Point Manual. And so, you know, let's see. Oh, here we go. Yeah. So you'll see a lot of these images on the web. All right. Actually, can we take a short break and then we'll come back? So 10 minutes. Okay, so just to continue with the trigger points are basically a type of Ashi point. All trigger points are Ashi points, but not all Ashi points are trigger points. Trigger points are a point where when you press on it, there's a radiation of discomfort or pain to an area or along a trajectory that's relatively predictable, right? So it also helps when treated to help enhance proprioception. That means like I have a better sense of where my body is in space. I have more awareness of my body or muscle. So I'm just going to show you like some examples. If you type in trigger points in like on the internet, and actually I think Leggy borrows or at least sort of recreates some drawings that are from Travell. But if you like type in, you know, trigger point, you'll see these X's are the trigger points, the muscle that it deals with. And also like in those pointillist red pictures, you'll see where the pain can radiate, right? So it'll radiate out into the local area, and it also radiate to some distance. I'm trying to find this one picture that's really good. Bear with me here. Sorry, it's taking a while. Yeah, here's another one for like the SCM muscle. Can you guys see that?
Yes.
Yes.
Right, so you can see that there's some pretty intense, you know, spreading of sensation by, you know, treating the points on the sternocleidomastoid trigger points. Right, here's one for the chest. Right, so a trigger point is basically a point similar to a motor point, but not the same, where it definitely stimulates the qi and blood flow through a certain predictable, repeatable area that could be described as part of like maybe where like the sinews and the primary channels kind of connect. It mostly deals with muscles, all right? So when you're working with trigger points, you're really working with muscles. And this is what a lot of people who do dry needling, this is what they're doing. They're needling into trigger points. So it's a hyper irritable spot. That means it like when you touch it, it's sore. There's a palpable nodule, sometimes a nodule, sometimes not, in the taut bands of the skeletal muscles and the fascia. Direct compression, that means you're pressing on it, or muscle contraction, that means they're using the muscle, can elicit a jump sign, that's fasciculation, local tenderness, local twitch response, that's the fasciculation, and referred pain, that's the main thing, referred pain, which usually responds with a certain pain pattern emanating from that spot, or a distortion of proprioception, whereas like where you press on that spot, you know, I don't really feel it at that spot, but they feel it in this other area. You know, like, oh, I'm pressing on lung 2. Well, that's weird. I don't really feel like pain there, but I feel it back here behind my scapula. Right? So that's a trigger point. And so when you treat these, what you're doing is you're stimulating the circulation of qi and blood through an area that allows that muscle to relax, that allows that fascia to smooth out. That's why you feel these taut bands or nodules. That's generally in the fascia or in the upper portion of the muscle, right? So you're helping the muscle to relax, and you're helping the fascia to smooth out and be more viscous again, because it should slide across the top of the muscle. You know, where you have inflammation, then that it gets sticky. And so there's a, you know, inhibited range of motion, there's less flexibility and more pain, right? Because of that inflammation, and the fascia and the muscles like get stuck and stick on each other. That's why myofascial massage is really helpful. You're breaking up these adhesions, these areas where its muscles are inflamed, and the fascia and the muscles are adhering too tightly, and there can't be this little bit of a slide, right? It's just like, imagine like you've got a shirt tucked in, and it's a really tight shirt, super tight shirt, and it's tucked in, and then you go to bend over. Well, let's say that belt, like that shirt is not just like smoothly on top of you. Let's say that like the sweat, like you've sweat a lot, and that shirt is really sticky to your skin, and you go to like bend over, you can't, because like the shirt is like stuck, right? So you've got, and it might hurt, like it's not just stuck, but it's squeezing, right? Right? So imagine the shirt isn't just something that you've put on, it's like attached to your skin, right? Well, you want it kind of loose, so when you bend over, when you lift up, like the shirt slides up, but the muscles stay where they are, right? So that's why myofascial massage is like so painful, because you're breaking up these adhesions. It's like Velcro. But once it's broken up, people are like, oh God, that's so much looser. There's less pain because you've broken up, you've like created space so that vents the inflammation, that vents the heat, right? Does this make sense? You've enhanced circulation. Okay, so those are trigger points. So these are some of the things that we're going to be using on or near the trajectory of certain channels to help the qi flow through the channel and the muscles and the fascia better. Okay? All right. Any questions? Okay, so I'm going to go ahead and share my screen. Okay. So while this is up, I don't see the chat function so well. All right. So if you all have a question, just interrupt and raise your hand, okay? Or not, I mean, not raise your hand, just interrupt me. All right, it's 10:30. We're going good on time. All right, so channel balancing. This is based on Dr. Tan's method. I remember, like, I don't know if it was like late 99, maybe early 2000. I remember getting an email from Jeff Millison saying, hey man, I came across this website, or somebody showed this to me. He was out in California on some meeting, and somebody was telling him about this guy, this crazy guy named Dr. Tan, who had this really interesting website. And at the time, it was just a really simple website. There was no explanation of anything. It was just, I just need to double check something. It was, and you guys can hear me okay? Okay. It was just basically his 5 systems. There was no explanation, no theory. It was just like, problem here, do this. Problem here, do that. So I tried it out, and I was like, wow, this is really cool. This actually really works. I don't know why it works. And then I heard, like, I kind of like did some digging, and then, because I don't think I had a computer at that time. And so, like, maybe I was in school or something, and I used like a friend's computer, and I found like that he was doing this workshop. So I flew out, and then I was hooked. So I probably took like maybe a dozen or so workshops from him, and and he was really, really fascinating. So this was a system that he developed to be a really simple way to enhance clinical efficacy. All right, so the term was first coined by Dr. Chen back in the early 70s. It's based on concepts that have been around forever. We talked about the Neijing, if the problem's on the left, treat the right. If the problem's above, treat below. If the problem's in the front, treat the back. It's also based on this different relationships between the Fuxi. Fuxi was an ancient master. And he developed a Bagua, whereas if you're standing in the center and then you're looking out, right, this is the arrangement of the Bagua. So it's as you've arranged these 8 trigrams around this, like in a circle around the center, they're read from the inside out, right, not from the top down. So Dr. Tan got a hold of this work, and he was formerly an engineer. I think he was like an aeronautical engineer, maybe. And so he put together this system. He packaged it in a really brilliant way, and he explained it in a really simple way that made it very accessible. All right. So it's basically a 3-step process. It's rooted in the Su Wen and the Ling Shu, right? I've just given you a couple of quotes you can look up if you want. The PowerPoint is on the Canvas site, so you can look at this again. So there's the Fuxi Bagua, and then the meridians are in various relationships with each other, and then they affect one each other in a different way. Think about it like all these officials, all these meridians that are related to these officials or extensions of the officials are like a family, right? You've got parents, you've got siblings, you've got kids, you've got aunts and uncles, right? You've got cousins, you've got grandparents, right? And so if you have a certain problem, and maybe you have like a beloved, like a significant other, like if you have a certain problem, like there's going to be some people who you can go to and talk about this problem and help you with it. And there's going to be other people which, like, they're not going to be helpful at all, right? And similarly, like if you've got a problem on one of the meridians, some meridians you go to, they're going to be like the go-to people to help with this problem in this meridian. And then there's going to be other meridians, they're really not appropriate or helpful in this case, right? And so there's 5 basic systems. We're going to cover 7, but there's 5 basic systems. So one is name sharing. And by name sharing, I mean the 6 divisional or 6 confirmation names. Taiyang, Yang Ming, right? Shui Yin, all those. And then Beijing branching channels, we'll get into that. So like Xiao Yang relates to Xiao Yin. right? Tai Yang relates to Tai Yin. Jui Yin relates to Yang Ming, okay? And this is all based on how these different trigrams that relate to the different channels and officials, how they relate to each other. The other is interior, exterior. That would be like what we know as the elemental pairs, right? Gallbladder, liver, spleen, stomach, pericardium, triple heater. Chinese clock opposite, we'll go over that. That's the time, right? You know, so each meridian, each channel, each official is predominant 2 hours over the day. So 11 a.m. to 1 p.m. is heart. So 11 p.m. to 1 a.m., that's gallbladder, right? And then you have your Chinese clock neighbor, same polarity. So around the Chinese clock, right? If you've got like bladder, a problem in bladder, bladder has two neighbors, one to the left, one to the right. So if bladder, right, is it about 2 o'clock, you've got on one side small intestine, on the other side you've got kidney. Bladder is a yang official, so we would look at the yang neighbor, which is small intestine. We'll get into this. System 6 is really simple. Same spot on the channel, you do the same thing on the opposite side, right? If pain is in large intestine 11 on the left side, I would treat large intestine on the right side. Same channel, same side. So lower bladder points, treat problems in the upper bladder channel, right? So for example, like if I've got like a lot of sinus issues around large intestine 20, stomach 1, right? I might treat large intestine 1 or stomach 44, 45, right? So like that. So it's a 3-step process. One is you identify the sick or the affected meridian. Basically, where does it hurt, right? So, you know, if I've got pain around like the lateral aspect of my shoulder, you feel around, you notice, okay, yeah, that goes through the large intestine channel. Okay, that's the sick meridian. That's the affected meridian. So you would write down on your paper, large intestine. And then you would determine which meridian you would use to treat that large intestine to bring balance and healing to not only the large intestine channel, but that area on the large intestine channel, in this case, the shoulder. And then after you've identified some possible meridians to treat, you would palpate and then choose points. And then we're going to go over each of these with a little bit of specificity so you have an understanding. So the pain is the light, right? Where the light is emanating, the light bulb, that's where the pain is, right? So you can do an Ashir point, like if it hurts around large intestine 15 and maybe just distal to that, like towards or maybe halfway to large intestine 14, right? You could do Ashir points. That's like treating where the light bulb is, right? Or you can, like if that pain is like a light bulb and you know you've got this switch across the room to turn on the light, then you would go over there. And so like that would be like opposite shoulder, opposite hip, opposite ankle crease. And people were like, that's really weird. Like, why are you doing that? And I say, well, okay, you've got a light or like a lamp, you know, or a chandelier or something in the center of your dining room ceiling, right? The switch isn't always necessarily like right under the light bulbs there in the chandelier. Sometimes it's across the room by the doorway, right? There's where the switch is. That's the acupuncture point I'm using to turn on or off this light, which is the pain, right? So again, there's different ways of identifying the needy meridian. One is you ask the patient where it hurts, and I ask them to take like a single finger. Some people still use their whole hand, and you don't know whether they're squeezing their fingers or if it's where the thumb is. So I say, take one finger, show me where it hurts. I also watch how they're touching the point. Is it very gingerly with very little pressure, or are they like really digging in there, or is it somewhere in between? Because that tells me how I can connect to the point, and also, you know, how deeply is my needle going to be going when I do treat, because skin treats skin, you know, fascia treats fascia, muscle treats muscle, bone treats bone, and so on, right? So when I'm doing these distal points, like how deeply am I going in? If they're pressing like way in there, I'm probably going to needle a little bit more deeply. If they're very ginger with it or just touching the superficial aspect, then I'll probably needle superficially. You can ask them where the pain is. I don't know much about the smelling, but you can definitely like listen to how they talk about their pain and their relationship to their pain, which also brings up emotions. So you're also like, in a way, listening or tuning into their emotions. And then of course, palpation is very important. So you're going to palpate the area that hurts, and then you're going to palpate the areas that correspond to where it hurts on those specific channels, which you're going to learn how to identify, right? So if it hurts at the shoulder and I'm palpating around the other shoulder, maybe doing like system 6, opposite side, I'm going to be palpating around that shoulder area for an Ashi point. I mark it, and that's where I'm going to needle. If it hurts really deeply, then I'm going to needle really deeply. If it hurts really towards the surface, then I'll needle superficially. All right, so the second step is to choose a system. So there's, it says here there's 6, there's actually 7 channels, 7 channels to choose from. A basic way of recalling this is like hand balances foot, more often than not, hand balances foot, foot balances hand. You would treat the opposite sides, right? So hand channels balance foot channels, not just the hand, because the hand does balance, you know, meridians on the hand do balance meridians on the foot and vice versa. But often you're looking at like a combination between a hand, say, Taiyang, and a hand and a foot Taiyang, or a hand Taiyang and a foot Taiyin. Okay, so you'll understand more about this, but just understand that there's like different opposites involved. All right, so there's 2 basic formats, and we'll go over that. Just give me a second here. So there's 2 formats, and I'm going to show you some images. I'm going to scroll ahead a little bit to slide 18, 19, and 20. So there's 2 formats. One is applied to the limbs, and the other juxtaposes the head, neck, and torso onto the limbs. Okay? So in a way, you have to use your imagination a little bit. So I'm going to scroll ahead. And you can see here's an example of the mirror format. Okay? All right, you guys with me so far? Okay, so just trying to move this so I can see it. Okay, so it's resonance, right? Remember, this is a resonance medicine, right? So, and you know, anatomically, morphologically, there's a lot of similarities between, say, the shoulder joint and the hip joint. Both are ball and socket, right? Both have like, you know, one very large long bone entering like, what's that called? Like, what is that? Labrum, like a labrum type structure, right? Ball and socket, right? One single bone, large muscles, right? You've got like the biceps femoris, you've got the biceps armus, right? They extend down into the knee, right? So you've got an olecranon and you've got a patella, right? Then they extend into the lower part of the limb with 2 bones. You've got a fibula and a tibia. You've got a radius and an ulna, right? Which then go into an ankle, right? So you've got a scaphoid and a pisiform. You've got a medial malleolus, lateral malleolus, right? Then you've got the metatarsals and then the metacarpals, and you've got the toe phalanges, right? And then you got the hand phalanges, right? So very similarity. What you want to be thinking about, whether you're looking at the mirror format or the image format, which we'll go over in a moment, is the way you navigate the terrain. The way you navigate the terrain is by virtue of the major joints. which is not foreign to us because all of our ACI locations are based on what? Major joints. From the wrist crease to the elbow, it's 12, right? From the elbow crease to the shoulder joint, it's 9, right? Lateral malleolus to the lateral knee crease, 16, right? 15 for the medial, right? From the thigh to the hip, it's, depending on the style, 9, 19, whatever, right? You know, so we're already used to doing that, right? If you're looking for stomach 38, you know, you're putting your hands down, and if you don't have a point locator, you know, you got your thumb and your pinkies. You got your pinkies at the malleolus and the popliteal crease, and then you got your thumbs sort of like in the middle, right, along the tibia. So we're already used to this. So we're using and identifying relationships and relative points, like, because this is a channel balancing system. This is not a point balancing system. So we're going to be doing spots. We're going to be treating spots along the primary channel trajectory that may or may not relate to actual named and numbered points. But that's not our guide. The guide is the trajectory of the channel between major anatomical landmarks, which are these joints, right? So as you can see, shoulder joint treats hip joint, vice versa. The elbow and the knee resonate. The ankle crease, the wrist crease relate to each other, okay? The joints of the fingers of the hand and the toes of the foot relate to each other, okay? Does this make sense? Okay. Right, so as you can see, like, fingers equals toes, hand equals foot, wrist equals ankle, forearm equals lower leg, elbow equals knee, upper arm equals thigh, shoulder, hip, right? Okay. And this can also be reversed. So the wrist joint resonates with the hip joint, then the hand and the fingers would be a little bit of an area above the hip joint towards the genitals. Okay. The elbow and the knee still relate. The shoulder joint and the ankle joint would relate. And then the foot and the toes would be that lower area, like along the trapezius, right? Above the shoulder joint, working towards the neck.
Time? Can I interrupt here?
Yes.
This is where Dr. Tan lost me, when he starts flipping things around, because it seems like, okay, you could just needle anything and it's meant to clear up anything. That was like my kind of cynical impression.
That's exactly right. Because you can break these up into even finer distinctions. Like, so for example, this, where you're juxtaposing the head, neck, and torso onto the limbs, you can go as far as the head. You can even take, like in Dr. Tan, in Master Dung, you can take the tubular bones, like of the thumb, right? That one, like if you stick your thumb out, you've got like let me undo this so you can see me instead of my screen. How do I do this? Stop sharing, right? You can even take this portion of the thumb and juxtapose like the whole spine on this. You can juxtapose the neck on this. You can juxtapose the whole, like the feet on this. It's crazy. Like it's like a hologram that gets finer and finer and finer. It's a little crazy.
Is the key intention?
Is the what?
Is it intention? Is it?
I don't know.
Who knows? Okay.
I really don't. It just does. It's just like, within every cell of just almost every, not every cell, but just about every cell of your body contains like the DNA for the entire being. You know what I mean? Like, how does that work? You know, and then they go in, they manipulate one gene, and then all of a sudden, you know, you got two heads, you know, or like, you know, your lung problems are fixed, you know, or now you're no longer allergic to whatever. Is it
Okay, thank
magic?
you.
Is it intention? I don't know. I think it's resonance. I honestly, I think it's resonance. I
Okay.
think there's a biomechanical, bioelectrical resonance, right? That is universal to our world, where green and spring and the liver and planning are all the same thing. They're just resonating at different frequencies.
Okay, thank you.
Yeah. All right. So let's go back to this. Share screen. All right. Can you see the slideshow?
Yes, we can.
Okay. Okay. So I'm not asking you to master this. I'm asking you to just take it in and just suspend your disbelief for a minute. All right. This is really about a holographic representation of resonance. Okay. Like, so the shoulder resonates with the hip anatomically and morphologically, right? In terms of the tissues, morphology, functionality, right? So system one, name sharing, is basically points on hand taiyang balance and are balanced by points on foot taiyang. So stomach balances large intestine balances stomach. Bladder balances small intestine balances bladder. This is system one. One is an odd number, so you would treat the opposite side. Now, we haven't gotten to choosing points yet. I'm just letting you know. So system two is an even numbered system, so you could do either side, the opposite side or the same side. But here, this is system one, name sharing, right? So the officials within Taiyang balance each other. The officials within Jueyin balance each other, right? Pericardium balances liver and vice versa. Opposite side. So here you go, right? Hand Taiyang balances and is balanced by foot Taiyang and so forth. Conception vessel balances governor vessel. Okay? System two is meridian branching. Now this is a little bit more challenging. This kind of breaks up the 6 divisions into a little bit more refined way. So now it's not yang treating yang or yin treating yin, right? Like say Xiaoyan, both are triple heater and gallbladder are both yang, right? Now we're breaking it up to yang and yin polarities. So hand tai yin is balanced by foot tai yang, right? So tai yin balances tai yang, Xiao yin balances Xiao yang, and then I say the other two. Then it's Jui yin and Yang Ming. But we take it a step further and break it up into hand balances foot and foot balances hand. So it takes a little bit of a mental juggling calculation, which is why I have uploaded to you the meridian chart. If you go on Canvas, and you can pull up the meridian chart, you'll see the systems all across the top, right? Let's see, 1 second here. You see the systems all across the top, and then you see the meridians along the left side, right? So name sharing. So heart is Xiao Yin, Xiao yin balances Xiao yin. So hand Xiao yin is balanced by foot Xiao yin. That's kidney, right? Heart is hand Xiao yin, which is, so Xiao yin is balanced by Xiao yang, but not just any Xiao yang. Heart is hand Xiao yin, so it's balanced by foot Xiao yang, which is gallbladder. Does this make sense? All right. So I've got it there for you. Whoops. You can see it. Right? These are how you balance it. So if you have a problem somewhere along the elbow of the lung channel, I know that elbow, again, go from general to specific, right? Always work in general to specific. So first there's the area. It's on the elbow. Where on the elbow does it hurt? Oh, lung channel. Okay. So elbow is balanced by knee. I've got the lung channel, so I know that system 1, name sharing, lung is hand tai yin, which is balanced by foot tai yin. So that's spleen. So where on the spleen channel do I go? Around the knee. Is this a point balancing system? No, it's a channel balancing system. So I'm going to be palpating along where I think the spleen channel goes, along the channel 1, system 1, opposite side. So if it's left elbow, I go to the right knee, along the spleen channel, around the knee. I palpate around for an Ashur point. I mark it out. I find all the Ashi points, and then I needle them. Does this make sense? If I wanted to do system 2 on the lung, lung is hand tai yin. System 2 is balanced by foot tai yang. That's bladder. So elbow equals knee. So I would look for bladder, meridian, Ashur points around the knee, which would be around bladder 40. It may correspond to bladder 40 or just above or just below it, like somewhere along the knee. All right, does everybody follow me so far? All right, since I can't see you, let me know if, like out loud.
It's a lot to take in, but I think
it is.
We're following you.
Again, I'm not asking you to memorize it. It's like, just get the concept, right? So system 2, you do sort of like a 2-step juggling process. Identify the needy meridian. In this case, maybe it's along the liver on the ankle, on the left side. So liver is foot Jue Yin. So that's going to be balanced by Han Yang Ming. That's why I've given you the chart, which is large intestine. So if it's by the ankle, ankle is balanced by the wrist. So I'm going to be looking for points or spots along the large intestine channel around the wrist on either the same side or the opposite side, because system 2 is either. System 2 is an even number, even either. So if it hurts on the left ankle, I could maybe treat Han Yang Ming large intestine wrist points on the opposite side, right? Or on the left side, the same side. Okay? All right. So system 3 is simple, just elemental pair. System 3 is an odd number, you treat the opposite side. Let's say I've got neck pain that hurts around the bladder channel in the back. Bladder is water, it's the exterior fu of water. The interior zang of water is kidney. It's worse on the left side, but it hurts on both sides, but it's worse on the left. So bladder is balanced by kidney. Neck equals ankle joint. So I'd be looking for kidney points on the opposite ankle. All right. Does that make sense? Okay. So system 3, right? Lung, large intestine, stomach, spleen, heart, small intestine. You know all these, right? And you would do the opposite side. right? If I've got that left shoulder pain around large intestine, I'm going to be doing right side lung points around the shoulder. Okay, so here's system 4, Chinese clock opposite. There's a couple of different ways to quickly figure out what is the opposite. The simplest way is to have a picture of the clock and you look at the other side. That's the easiest way. The next easiest way is if you have them memorized by time, you just flip AM and PM, right? So if you've got a problem on the stomach channel, stomach is from 7 to 9 AM, you would look at what's the meridian that goes between 7 and 9 PM, and that's the pericardium. Here's another way, which was easier for us as Worsleyites who learned the officials by their Roman numerals. So there's 12 meridians in the whole system. So the opposite would be 6 hours apart, right? Excuse me, 12 hours apart, but there would be like 6-hour differences, right? So what you can do in terms of the Roman numerals, right? You've got Roman numeral 1, heart, through Roman numeral 12, spleen, right? Each one is 2 hours. So 12 divided by 2 is 6. So there's these so the opposite side would be 6 meridians away, 6 sections away, right? So if you're looking at like the line, like at pericardium, you've got kidney, bladder, small intestine, heart, spleen, stomach. That's 6 meridians to get to the opposite side, right? Because they're 2 hours each. So what you can do is you could take whatever Roman numeral it is, and if the issue is on, say, the small intestine, right? So that's Roman numeral 2. So you would add 6. So 2 plus 6 is 8. 8 is liver. And if you look on the chart, opposite small intestine is the liver, right? So if you've got Roman numerals 1 through 6, you add 6. If you've got Roman numerals 7 through 12, you subtract 6. So let's say you've got hip pain on the right side on the lateral aspect that equates with the gallbladder. Gallbladder is Roman numeral 7. 7 minus 6 is 1. Roman numeral 1 is heart. Gallbladder also is 11 p.m. to 1 a.m. So if I switch 11 p.m. to 11 a.m. and 1 a.m. to 1 p.m., I've got the time for the heart. Or I could look at the chart and I could go across it and get to heart. This is system 4. 4 is an even number, so you could do the either side. So if I was treating left gallbladder hip pain by using the heart channel, I could use heart, probably that deals with, right, hip is balanced by shoulder. So I would look for heart points around the shoulder joint, which would be heart 1. System 4 is either. So if I've got left hip pain, I could either do heart 1 on the right, opposite, or heart 1 on the left, same side. All right, let's just check in. You guys, I can't see you guys, so let me know. Just give me a verbal yay or nay that you're following this. Not that you have it memorized, not that you have it completely understood, but like you're getting the concept.
I'm barely getting it, but yeah.
Okay. All right.
I feel like it's a very logical sequence. So from a fundamental perspective, it makes sense. And learning it feels kind of overwhelming because it's a lot. It's a big system to navigate through and then to layer on top of what we already have. So I'm hopeful that as we move into the individual systems, that'll support the incremental learning that at the end of the semester, all of this will be like, oh yeah, I know what he's talking about.
Yeah. By the end of the trimester, you'll be doing this in your head.
I'm trusting you on that one.
So here's my guarantee, because I This is not, I'm not being self-deprecating. Like, I love who I am, but I learn slowly. I learn slowly. That's just the way it is. And I have to learn by doing. Like, you can tell me stuff and I'll be like, yeah, okay, I get it conceptually, but I don't really get it until I've done it 100 times or a dozen times or whatever. So
That's
we're
me too.
We're gonna be doing some exercises where you'll get it in your body. Yeah. Okay. So, all right, let's continue. Actually, let's see. Do we need to take a short break, like maybe till 1/4 after? Actually, let's do the fifth system and then we'll take a break. Is that okay?
Yes.
Yeah.
Okay,
Sure.
great. So system 5, yeah, so there's system 4, right? Again, you've got these slides, all right? So system 5, really simple. Chinese clock neighbor. On the clock, on the meridian clock, every official has 2 neighbors, one before it and one after it. Whatever official has the problem, or whatever meridian has the problem, let's say our gallbladder hip pain on the left side. Gallbladder is a Fu. So you want to go to the Fu neighbor, not the Zong neighbor. So liver and gallbladder do balance each other by system 3, because the interior-exterior elemental pair. But for system 5, Chinese clock neighbor, liver is yin, a yin official. Gallbladder is a yang official, but triple heater, triple burner is a yang official. So I'm going to be looking at points on triple burner. So if I've got left hip pain along or around the gallbladder channel moves through it, this is an odd system. So I'm already going to be looking on the right. What balances the hip? The shoulder. So I'm going to be looking at triple burner spots along the triple burner trajectory around the shoulder on the opposite side. So if it hurts around, like say right in the center of the joint, I'm going to be probably looking at or around triple heater 14 on the opposite side. All right. I know that's a lot. I know it's a lot. All right, so let's take a break. Let me stop sharing my screen if I can. Yeah, you guys are like, thank God, a break. Look, believe me, like it took me quite some time to really get this, but I promise you. Oh yeah. Whitfield's got these like free things that you can go and learn from him. They're decent. They're not bad. I've studied with him. It's pretty good. I would highly recommend them. So let's take a short break. So it's 11:05. Let's come back at like say 11. Let's do 11:15. All right. Okay. Current slide. Here we go. Okay. So, all right. It does get a little tricky. Okay. And believe me, I'm giving you the simple version of this. The holographic juxtapositions can become quite elaborate, especially when you're looking at like Dr. Tan, Master Dong points. Okay. But for now, right, you can also juxtapose the head, neck, and torso onto the limbs, right, and vice versa. This is actually the way that makes more sense to me. Some of you might find it easier this way, where like the top of the hip is the top of the head, the top of the shoulder is the top of the head, the tips of the toes is sort of like the genital region, right? The tips of the fingers is like the genital region. For me, there's something about this way that just makes more sense, where the foot and the hand juxtaposed to the head, and then the ankle and the wrist juxtaposed to the neck, and then the knee and the umbilicus, and on the back do 4, right? Gate of life. You know, Ming Men, and then the elbow all resonate, and then like sort of like the genital region, and then the like sort of like the pubic symphysis and the hip joint and the shoulder joint just seem to match up a little bit more for me, right? It just seems to be a little bit easier for me to understand it this way, but whatever works for you, okay? And again, when it comes time to treating like disorders of the neck and disorders of the elbow and disorders of the wrist and so on, we're going to be touching upon this, and you'll see it much more clearly. All right. All right. You can go even so as far, we're not going to go into detail about this, but you can even juxtapose the whole head onto the whole arm, right? Rather than, you know, the head onto the hand, which only gives you like, you know, 6 inches of points, right? But if you juxtapose the whole head onto the whole arm or a whole leg, where the eyes are like the elbows and knees, look how much, you know, you've got a lot to work with here in the whole hand, I mean, the whole arm and the whole leg, right? So if you've got like inner ear problems, you're going to be looking at points like just distal to the elbow or just distal to the knee. If you've got eye problems, right? I mean, you know, stomach 35, eyes of the knees, right? Lung 5, you know, heart 3, triple heater 10, small intestine 8. You know, these are all great for problems around the eyes. Headaches, right? Okay. All right. You can also flip it around, right? Okay. So there's a basic guideline to experimenting. You know, like one thing is you could go out and buy a 6-sided die, right? You can get like a pair of dice, take one of them. It's got 6, it's got 6 on them, 6 numbers. You roll the die, doing system 3, great, right? You roll a 4, we're doing system 4. You could pick a system and go whichever one, like this month, and this is what I would recommend this month, everybody gets system 1 and I try it out, right? If a system doesn't work, if you don't get results within a minute, pick the next system, take the needles out, try system 2, put the needles in. If you don't get help, if you don't see improvement with some improvement, because some, you know, it might get more improvement over the time of you leaving the needles in, 30 to 45 to 60 minutes. But if you don't get any benefit from like within a minute, I take the needles out, I go to the next system. In general, system 1 is great for limb pain. Is it only good for limb pain? No, absolutely not. I've used system 1 for migraines, works great. I've use system 1 for like pain that's from internal organ pain of the stomach, works great. But it works best, I think, for limb pain. Systems 2 and 4 work great for torso pain. Only torso pain? Nope. Works great for torso pain, but for anything else. System 3, internal issues, asthma, reflux, migraines, but it works great for everything. Right? I think, you know, the best points generally are below the elbows and knees that include the 5 shu points or in the neighborhood of the 5 shu points, right? So let's work through a case, right? So you've got like the sick or affected meridian. I don't know why I just don't like calling it the sick meridian. It just, I don't know. There's something about it that's just like, I don't like to see it as like sick, but you know, whatever. It's the affected meridian. So let's say you've got knee pain around the patella, right around the kneecap, around the area of stomach 35 on the right leg, right? So it goes through the stomach channel. So here's the 5 systems. Again, system 6 is same spot, opposite side. So it would be, if this is on, you know, problem on the right leg, right knee, you would palpate the area of stomach 35 on the left knee or needle that area. But here's the 5 systems, right? So you've got large intestine, pericardium, spleen, pericardium, large intestine. So how do you choose? You could roll your 6-sided die, and, you know, 6 being same spot, opposite side, and go with that. You can pray, you know, oh, my Lord, give me a number between 1 and 6. And, you know, however you communicate with the Most High, you get 3. So, okay, I'm doing spleen. You can choose whichever one's most sensitive to palpation, right? So again, some of these are arm channels, pericardium, large intestine. Some of these are leg channels. So this is system 2. So you can do either, right? 2 is an even number, even either side, either the left side or the right side, either the side opposite the pain or the affected side. So large intestine, pericardium, they go through the arm. This hurts at the knee. Knee is balanced by elbow. So I would look at points along the large intestine channel around the elbow, or pericardium around the elbow, and palpate around there and see if any are Ashur to the patient. Most of the time, patients aren't going to give you a lot of information regarding whether it's Ashur or not. I don't know if it's just because most of the Americans that I treat are pretty divorced from their body, or you know, our diet, the sort of the standard American diet, the SAD diet, generates like a ton of damp and phlegm, which tons and obscures sensitivity and sensation, which is why people are probably so intensely, ferociously reactive right now, because that's the only thing that can cut through the fog of this obtunded ignorance that is facilitated and exaggerated by our diet. So most of the time, like, I don't get a lot of feedback from the patients. I'm like, what's this feel like? It feels like you pressing. What's this feel like? And I don't feel anything. What's that feel like? And I don't feel nothing. Okay. So then might be, what information do I get from my palpation? Right? Oh, this feels really like overly yielding. Oh, there feels like there's like a knot there. Oh, I'm feeling like kind of like nodules. Oh, you know what? This spot feels a lot colder than the other spots. This feels a lot warmer. This one's drier or more moist, right? So that might be how you guide to treat one, right? Like, you've treated points around large intestine 11. You've palpated points around pericardium 5. You've palpated points between spleen 9 and 10 along the knee, right? And, you know, maybe, okay, again, this is a channel balancing system, not a point balancing system. So I'm not going to be doing spleen 9 or 10. I'm going to be palpating along the spleen channel, along the opposite, you know, knee condyles, right? Knee crease. And maybe that's the one that feels like the weirdest to me. So spleen, you know, that's system 3. 3 is an odd number. So I'd go to the opposite side. That's the left side. So then I'd needle in put in like a bunch of needles to about the depth of that corresponds to the depth of like where they feel the pain. Maybe they feel the pain like deep inside the patella. So I'm going to be needling deep into the joint, right? Or as deeply as I can. Do I do just one needle? No. I mean, you can kind of shotgun it, do 3 to 5 needles in that area. That's how they do it a lot with like the, what's it called? Like, it used to be called the, was it like the, it's POCA. What does that stand for? Oh gosh, community acupuncture. Yeah. Right. Because they have to work really fast, right? So, or you could go more surgical and strategic. You could palpate, get the spot that feels like the most sensitive to you or the patient, or the one that corresponds anatomically most closely to the area of pain, right? Along the spleen trajectory. Okay. Or you can go by limb pain system 1, right? So any of those is good. All right. So then you would choose points. So again, you know, large intestine, pericardium, spleen, right? You would mirror, you're using a limb to limb. So that is necessarily the mirror format, right? Leg corresponds to arm corresponds to leg. Okay. So when I chart it, you can use the distance between the nearest points and make a fraction of that. So like halfway between spleen 9 and spleen 10 would be spleen 9.5 or 9.5. So in my chart, this is how I would chart it. I would write spleen 9.5 or 9.5, comma, L for left side. And then in parentheses, the number of needles I use. Let's say I use 2. So it would be spleen 9.5, comma, L, parentheses, 2 for 2 points. And then, then my needle symbol, and then I would probably put it in even technique. You don't have to tonify or sedate with this strategy, with the balance method. You can just put it in even. If you feel strongly that this is more of an excess type pain, it's sharp, right? It's worse when the damp, rainy weather, right? It hurts with strong palpation, right? So I want to sedate. That's fine. You can do that. It feels better with pressure. Weather changes don't really affect it much. The pain is dull and achy. It's not real severe. It's kind of like in this area, not like a spot. So I might look at and their pulses are deficient. So I might say, oh yeah, that's a deficiency. I want to tonify. You can tonify. Most of the time I just do even technique. All right. All right, let's see if I can get out of this here. I'm trying to stop sharing. And it's, oh, here we go. Stop share. There we go. Okay. Now I can see you all. So any questions about that before we do like another case? Actually, any questions? Yeah, first, I'm sorry. My mind I get so excited about this stuff, so I'm running ahead. Any questions about this? Not like, oh my God, my head wants to explode. It's more like, again, you're just learning. Yeah, I just want you to, the goal for today's class is just to introduce you to this. It's not for you to like be masterful at it. Any questions? Okay. Who here has a pain on some part of their body that's identifiable? Like right now. I find it inconceivable that no one has no pain. Okay, John has a pain. Where do you have your pain?
It's in the area.
I can't see
sort
you.
of between.
Can
You want me to point?
Yeah. Take one finger and show me where it hurts. Right there. Let the record show that Mr. Pilgrim is pointing to his left suprascapula in the area of small intestine 12. Kabish? On the left side.
Yeah.
Is that about right? Now we could
Yeah,
go through
that
all
area.
of the primary and sinew meridian assessments, which you will do. But again, this is a primary channel balancing system. So he points to small intestine. So I write small intestine. And just like on your grid, right? Le grid in French. That was a joke. So I go down to small intestine. I go down to small intestine. I don't know any French. So I look at, okay, so system 1 is bladder, system 2 is spleen, system 3 is heart, system 4 is liver, system 5 is bladder again, and system 6 obviously is same spot opposite side, would be in the area of small intestine 12 on the right. So I've got a choice. I can choose bladder, spleen, heart, or liver, right? Now, one of the things that I note is that, wow, bladder balances the small intestine via 2 different systems, systems 1 and 5, right? It's the Tai-Yang pair and the Chinese clock neighbor. So that might say to me, that might suggest to me that I might get more bang for my buck, right? More chi for my needle if I do a point on bladder, because I'm getting the benefit of 2 systems. So it's like, I'm not just enrolling one family member with my problem, I'm going to 2 family members and have them work on my problem, right? Or I could say, well, I think he's an ERCF, so I'm gonna go with spleen. Or I'm going to use palpation, or I've got my 6-sided die, I roll a 4, so I do liver. Right? So all are fine, because if one doesn't work, you just go to the next, right? Or today, this week I'm doing system 2 on everybody. Fine, right? So what I would do is, this is a longitudinal channel balancing system. Small intestine does zig and zag, right? You've got inner bladder and outer bladder. Doesn't matter. Where is it in relation to the primary joints longitudinally? Where is it on the body? So the scapula up here, right? So here's the top of my head. This is like sort of at the level of the base of my neck, right? Above my shoulder, right? So if I go back to slide number 23 or 24, let's go to say 20, let's go to slide 26. Please open your hymnals to number 26. Right, so again, you're seeing the front of the body, but it works just as well for the back of the body, right? So it's just below the crest of the shoulder there on the left side. So if I do like the reverse imaging like I like this is going to be just proximal to the wrist. And just for not for nothing, the scaphoid bone, is this, no.
This
The pisiform is on the front. What is this called? The head of the ulna, like around small intestine 4, this crease here, small intestine 4, large intestine 5, that crease is about C7. That's sort of like the space between C7 and T1. All right. I'm just giving that to you now because we're using an example. So that's a landmark. That's what I'm going to be using to find my relative area of needling. So this equates, right? And similarly, the ankle crease is like C7T1. Okay? And this hurts just south of C7, sort of around like T1 area. Maybe even but maybe between T1 and T2, but around T1, right? So that means I'm going to be just proximal to, right? I'm going south down, inferior. So inferior this way is proximal. So I'm going to be looking at points in this area of the wrist, and I'm going to be looking at areas just proximal to the ankle crease. Okay? So if I'm dealing with heart and small intestine or really just heart in terms of the 5, I'm going to be looking at just proximal to heart 5, right? Because if this is C7, T1, and it's at about T1, T2, I'm going to be going just proximal. And then, so heart balances it via system 3, right? It's the elemental pair. So I'm going to be going to the opposite side. So if it hurts on the left, I'm going to palpate or have John palpate. John's giving me the finger. Okay, sorry, hard to see. All right. He's palpating just proximal to heart 7, right? Now again, this is a channel balancing system. It might equate to heart 6 or heart 5. That will come in later, and we'll go into this later. But right now, it's just proximal to or around heart 7. So what I want John to do is palpate in there and let me know if he feels anything unseemly. No? Yeah. See, I mean, yeah. I mean, even like the most attuned are like, yeah, I don't feel nothing. Right? That's not uncommon. So I don't go so much by Ashur, although I like to when I can. And when I do get some kind of feedback from the patient, I definitely will use that and needle where that is. But for right now, we know that this area in general relates to this area here, right? Because this is the hand, right? And then the neck equates to the wrist. And then just, you know, just proximal to the neck is just proximal to the wrist, right? So I'm going to be looking at points along this area. And so what you want to do is kind of what I call cover your margins, right? Make sure you get like the full area there. So I might extend it just beyond distally and proximally. So I might put 3 needles in here, like around heart 7, maybe around heart 6, maybe around heart 5, right? On the opposite side, stimulate them just a little bit, I don't really tonify or sedate, but you could say, yeah, this feels like a big knot. So that's like an excess. You might say, I might sedate. That's fine. Or you might say, well, I don't like to sedate points on a heart. They told us that wasn't a good idea. So I'll just put it in even to be safe. That's fine. Right? You see how I'm like thinking through this? All right.
Time?
Yeah.
Quick question. Is the place where John pointed, isn't it distal from the neck? So would we go distal from the wrist crease? No.
Yeah. Again, it's this way. We're looking this way, not this way.
Okay.
We're looking this way, right?
Mm-hmm. Oh, okay. So when you
now you get it.
Up. Okay.
Yep.
All right. Thank you.
Yep. See, you're getting it. Yeah, good. All right. So then I would needle like a couple of needles in there, right? Maybe you're on a budget, so you want to be more surgical. I want to get it to 1 needle, right? So I get like, okay, this is where I feel like the most feedback from me in my fingers is right there. So I needle there on the opposite side. I wait a minute and I say, okay, we go back to that area. I have the patient either move it if they can, or feel into it if they can, or pay attention to it with their mind. And I ask, is the pain better, the same, or worse? Knowing that it will never be worse, but I give it to them because people like things in 3s. They hear it better. Is the pain better, same, or worse? And they say, if it's about the same, then I'll give it another couple minutes and then check in. And if it's not better, then I'll take needles out and I go to the next one, next system. If it's better, then I'll say, okay, on a scale of 1 to 10, which I might have asked earlier. So John, on a scale of 1 to 10, how would you rate the pain right now, 10 being the worst and 1 being no problem? A 6? All right. So then I would say, okay, you said it was a 6 in the beginning, so how would you rate it now? Right? And then they would tell me. And I would say, is that good enough for now, or do you want me to keep working? Like, let's say they say it's a 3. They might say, actually, I don't really like a lot of needles and I can live with 3, so 3 is good. So, okay, we're done. And I go on with the rest of my treatment and I leave that in for at least 30 minutes. Again, Wei and Ying move through the cycles every I think it's every 28 minutes. So you could leave it in for a half an hour. You could leave it in for an hour. If they're an older folks, I don't like to leave people with needles in for an hour. They get stiff, they get tight, they get crampy, they get sore. People who are very deficient, excessive needle retention can mimic sedation. So, if the patient's older, very deficient, I don't really like to leave needles in more than 30 minutes. Younger folks, you can leave it in 45, 60 minutes. That's fine. Okay. If the patient, okay, let's say that brings it down to a 3. Actually, do you have needles on you? Are they handy? Can you stick a couple of needles in? Yeah, let's do that.
Yeah.
Okay. So while he's getting needles, I'd say, well, so let's say that brought it down to a 4 from a 6. You're like, yeah, I really like to keep working. Then you pick another system, right? So small intestine is balanced by bladder, spleen, liver, right? So then I go around to the ankle crease, just proximal to that, right? Because the foot is up by the head, then the ankle is going to be the neck, and then just proximal to that is going to be up more towards the knee. So I'm going to be looking at points on bladder up from bladder 60 towards 59. And I'd palpate around. Again, system 1, opposite side. System 5, opposites, odd numbers, opposite side. So I'd be looking at the right. And then I palpate around. Maybe they feel something. Maybe I feel something. Maybe none of us really feel any difference in any way. So then I would just put in needles around that area that corresponds to that area just proximal to the neck. which would be that area of bladder, say between like bladder 60 and 59. And I'd put in like, 3 needles or so, and then I'd have them check it out again in about a minute. And it should really be effective that fast. Does that make sense? I'm judging by your silence that you are either off, everyone's off in another room getting a cupcake, or you're all good.
There's cupcakes?
You don't smell them?
Great. No, love one though.
I know, I had some ice cream last night and now I can't breathe out of my nose. All right. So you can do more than one system at a time. Just take the needles out. If it doesn't do anything, don't worry about it. Like if it doesn't work in a couple minutes, it's probably not going to. Take them out, go to the next system. I can count in 20 years on one hand the number of times where no system worked. All right. So John's needling himself.
One thing that I really liked about this treatment is that since we can't reach our own back, it seems like a great way to treat ourselves too.
Indeed, indeed. You got like a low back or like in the middle of the back or like in your neck and like it's kind of hard to get in there. You have access to your hands, your wrists, your arms, your legs. Yeah. And it's really good for people who, you're somewhere where like, or like some people like it's hard to get access to different parts of their body. Like I treat people in wheelchairs and I can't get to their hip,
Have you heard of AE treatment done on the arm instead of the back?
So I think the reason why, like JR said, like, okay, unless you drain AE, your patient will die. And everyone dies, so I guess that's that. But I think the way around that, I think the TCM workaround is a pretty consistent use of the low points to vent, and Jing Wells to vent to the exterior. That superficial pathogenic heat. Yeah. All right, John, you got some needles in there? Can we see your wrist? Power to the heart. He's got 2 needles in there. All right. Those are 2 inchers? No, just the 1 inch? Okay. All right. So manipulate them a little bit. Give it a little bit of more manipulation. Yeah. So what John did is exactly what I want you to do. You put the needles in, then you have the patient, if they can, move around. It is not uncommon for me to put needles in some part of their body and have the patient get up off the table or get up out of their chair and walk around. If possible. Obviously, if needles are in the legs and stuff, it's difficult. But if you can activate the area, either with movement like John is doing, or you massage that area, right? Like, let's say movement doesn't really do much. I go behind John. I would massage into that area, either with my hand or the heel of my palm or my fingers, and get some chi and blood moving to that area. All right, is that feeling any differently?
Yeah, the pain's gone.
Okay, so there you go. It's that
simple. I'm a believer.
It's amazing stuff. And to anyone who says, because again, Bob was kind of like my mentor, and he said, God help you if you ever take away someone's symptoms. And I think what he meant is you don't want to enable ignorance. But once people are in pain, there's no physiological benefit to remaining in pain. In fact, it's a detriment. It's physically and mentally destructive to remain in pain. Like, okay, I got the message. I got it. Like, you don't have to keep okay, I'm ready for my migraine to leave now. Like, I don't think that's going to just, we're not going to turn John into an idiot, because we've taken away his shoulder pain. The message is still there. He can still learn about the comings and goings of his, discomfort here to help guide him to take better care of himself. both physically as well as psychologically and emotionally, right? I think it's, maybe as Bob got older, he got a little bit more like jaded or something about like about the potential for people to change their behavior or wake up. I'm still relatively optimistic that you can help cultivate an observer and help somebody in pain in the moment. Because again, what's the highest form of medicine is the superior physician treats society. So if John's out of pain, there will be functional improvement, which allows him to care for himself and others and tend relationships more, right? If John's stuck in inactivity, he's of no service. So that's my spiel. All right. So that's an example of it. I don't want to like, do you feel like your guys are full, or do you want like another example?
Could you do one more, please?
Yeah, sure. Okay, so let's look at, can you see my screen?
No, we just see you.
Oh, you just see, okay, let me share my screen here. Okay. Current slide. Okay, so let's say, I don't know, do we want to do that one? Bell's palsy. Let's do this one. So let's say somebody has like some heartburn, right? And their heartburn is so severe, you can actually see it through their clothing.
I don't know.
That's some severe heartburn. All right, so you can see where the woman is pointing, center line, maybe a little lateral, right? Again, you're looking for your major landmarks, which you could use as anatomical landmarks, such as the clavicle, the solar plexus, individual points, okay? Either of those is fine. We can see that the pain traverses the conception vessel, the kidney channel, and the stomach channel, right? Somewhere in that CV14, CV20, like maybe maybe even up to like stomach, like what's that, like 16? Okay, all right, I'm trying to, there it is, okay. All right, so as you can see, GV balances CV, kidney is balanced by heart, triple heater, bladder, large intestine, pericardium. Stomach is balanced by those meridians. And as you can see, large intestine and pericardium balance both. So that's probably where I would start, because you kind of get like more chi for your needle. Now, you could sit the patient up or have them lie on their side. And so you can get to the GV points, right? And again, it's not like GV point, it's just like along the trajectory of the GV, and I would definitely encourage you to needle points or spots along GV that are in the intervertebral space. Unless the person's like pretty well upholstered, it's going to be uncomfortable needling like right over the vertebrae. So in this case, there's bilateral pain. So remember, left balances right, right balances left. So if you've got pain bilaterally, you would needle bilaterally, right? Because your right side needles would balance the left side pain, and your left-sided needles would balance the right side pain. So you would needle bilaterally. That's okay, you can do that. Or you can say which side, if you had to say, like, is there one side that's worse than the other? And then just focus on that, law of least action, right? But I have here bilaterally because, as you can see, the patient's pain is bilateral. So I'm looking at large intestine and pericardium, right? They treat via multiple meridian. So if you go back and look at, let's see, do I show it here? If you go back and look at here, right? So the solar plexus, right, corresponds to the area just distal to the knee and the elbow. Now again, you can do it this way, where the area would then be just proximal to the knee and just proximal to the elbow. Either is fine. You know, sometimes I'll do both, because then you're, you know, again, it's not law of least action now, but you're really like giving a very enhanced treatment, you know, because, and this is where your intention comes in. You do your intention this way, you're needling just distally to the elbow and the knee. And then via this system format, you're needling just proximal to the knee and the elbow. So, you know, if you were to translate this into points, this would be like close to large intestine 12, close to stomach 34. But again, this is a channel balancing system. So you're not really focusing so much on points, you're focusing on spots along the trajectory. So I would do like a couple of needles on, right? What were we working with? Yeah, so
large intestine,
pericardium and large intestine. So I'm looking at, right, pericardium 4 to pericardium 6. That's a long window. You don't have to go all the way that high. I would say that, you know, that's like overkill. I just put it in there where you could get like really large margins. But I would say, you know, again, relatively, how far is it between, say, you know, like the clavicle and the umbilicus, or the solar plexus, yeah, like the umbilicus or the neck and the solar plexus, and you divide that out, and that's how you would divide between like the wrist crease and the elbow, or the ankle crease and the knee, right? Because the bottom of the throat would be like the wrist or ankle crease, and the umbilicus would be like the knee or the elbow. So if it's halfway, then I do halfway. You understand what I'm saying? So if the pain in the solar plexus is halfway between the neck and the umbilicus, if that's halfway, then I want to do halfway between the knee and the ankle, or the elbow, the elbow and the wrist, right? So that would be points along the sort of like the middle of the calf and the middle of the forearm. And again, you don't have to do points, it's spots along the channel. All right? And so again, you know, for these, it's systems 4 and 5. So you could do, and 1 and 2. So you've got an odd number and an even numbered system. So you could do both sides, which you would do anyway because it's bilateral. So I would plunk in a bunch of like pericardium points, like 2 or 3 on each limb, and then a couple 3 points along large intestine on each limb, you know, to balance that area. Okay? And what I would suggest is maybe practice this on yourself. It's not going to be homework, right? But maybe see, you know, like if you have a sore spot, or if you're, you know, if you're not clear, like what area of the body relates to that area that's in pain, just text me or call me. And believe me, in 60 seconds, we'll have it figured out. But for now, just go by the, you know, just do your best to go by those images on those different slides, like, you know, around in the 20s. Right? Yeah, like 21 through like 27, 28 or so. All right? And so I would practice on yourself, see what that's like. You know, anybody here have headaches? Nobody ever gets headaches?
I do.
Okay, where's your headaches usually?
Usually above my right eye or in the temples.
Okay, so we're
It's
talking
usually
about
a player,
gallbladder.
too.
So that's definitely gallbladder,
Hmm.
right? First of all, it's one-sided. That's often gallbladder. And it's like just below gallbladder 14 and around like, gallbladder probably 4, 5, 6 maybe. Or maybe, yeah, like in that area, right? So if gallbladder is like the meridian that's involved, then I would look down on my chart. And so system 1 is triple heater, system 2 is heart, system 3 is liver, 4 is heart, 5 is triple heater. You'll see that some of these like are kind of mirrored. So you've got triple heater, heart, and liver. So you can juxtapose the head onto the entire limb, right? That's slide 28 and 27, right? So if you look on slide 27 and 28, if it's just above the eye, if you're doing like the reverse image, which I like, where the foot and the hand are at the top of the head, right? And the chin is like the hip and the hip joint and the shoulder joint. But whatever's your affinity, or do both, right? So just above the eye is going to be just distal to the knee and elbow. So you could be looking at triple heater points just distal to triple heater 10.
I was going to say that's actually what was tender yesterday when I was doing the movements.
Interesting.
Was triple energizer 10.
Isn't that interesting? Right?
Yeah.
See, all of this relates. It all resonates together. This is all happening at the same time. I'm just trying to piece it out for you to then start to treat, and then with your treatment results, you're going to start making more connections. It's just going to happen. Like if someone like me can make them, I guarantee you guys can, right? So I would do triple heater opposite side, right? System 1, system 5. So I'd be looking at, if it's on the right, then I'd look on the left, and I'd be palpating around, like, just distal to triple heater, like along here, right? Yeah, like along here. And then I would needle that area, right? Heart, again, some people don't like to deal with that. Maybe you're less sensitive in your legs, so we do points that are just distal to the knee crease of the leg on liver. So like liver 7 area, right? So if this is like halfway between, like if this is like at the knee and this is at the tip of the foot, this is like just a scooch, like, towards the foot, towards the ankle crease, right? So you would just palpate around, and you'd probably have about, I'd say, if on my fingers, I'm looking, this is about 3 inches. You've probably got about a good 3 to 4 inches of liver channel distal to liver 8 that you could palpate and needle along and see how that feels, right? And since it's at the temple, which is a little higher, you can go a little more distal towards the ankle, towards the foot, to kind of cover that too. And if you want, you could needle that bilaterally. Yeah. So that's the basics of the balance method. So what I would recommend is, again, you don't have to hand this in, you don't have to turn it in, but what I would recommend is either using palpation with acupressure on someone else, or needle yourself and see how this goes. Again, thinking longitudinally. So it doesn't matter whether, like if it's on the bladder channel in the back, it doesn't matter whether it's inner bladder or outer bladder. It goes by virtue of what's the distance between, say, like CV7 and the waist, do4, right? And then you use that as your relativity. It doesn't matter whether it's lateral or medial. It goes this way, right? Does that make sense? And I'm just going to put one little bug in here because we have 2 more minutes. Since this is a resonance medicine, let's say the heart points worked for John really well, which it looked like they did, right? So that's a fire element official. So we've got the fire element, we've got the heart official, and we've got these local points dealing with the general, little more specific, much more specific correspondences. So if this is medicine for John's shoulder, I would then ask into correspondences of the fire, the heart official, and these points specifically to see if that's showing up as missing in John's life. Now, again, I don't want to get into details because, I like to, support people's dignity. So we don't have to get into anything personal. But what I would say is since this made you feel better, I would say this is medicine for this. And if this symptom is a teacher, I would say John either needs more fire in general or some correspondences around the heart or something about like these correspondences of what these points represent on a body, mind, spirit level. Could be body, could be mind, could be spirit level. That's going to be what John needs more of in his life, right? If treating triple heater helps Jonathan feel better in his head, then he needs more fire / triple heater / whatever, like the elbow or these points represent more of that in his life. And this is the doorway to a more like mental level, spirit level conversation, because you know what these correspondences are about, so you can ask into those correspondences and the condition of those things in someone's life. Are you getting enough camaraderie, partnership, intimacy, love, warmth, heat from the outside? It could be something like, are you getting enough time in the sun? Right? There's like 100 things you could ask about. But knowing what you already know about the patient based on your TD and your little mini intakes at the beginning of V treatment, you know where somebody's wobbling and where somebody's thriving. And you might blow someone's mind by saying, you know what? Let's find a way to get more of this in your life. And you help them, like you guide them you educate them as to what the correspondences are, and they can connect the dots in their own being. They can go, oh yeah, I could go for a walk in the middle of the day when it's more sunny, or I could spend more time like the hot shower, or I could reach out to people and connect to them more and create more camaraderie or partnership, or I could, whatever, fill in the blank with the correspondence of the fire, heart, points along that heart channel, right? Does this make sense? You're helping them find the medicine for what ails them. And if this is just a shoulder problem, then there's things that we can engage with on a physical level for the heart, the fire, and the heart points to help this area, right? It might be just a physical thing, but it might not be a physical thing. So you're helping to open up somebody to the possibilities for greater medicine where they can discover it for themselves, or you can discover it in your conversations of the correspondences. This is a powerful thing, and it's really like transform people's lives. Yeah. All right, so we've gone 2 minutes over, so I'll leave it at that. I'll try and upload the recording. If you guys have any questions, by all means, just contact me, let me know. I'm happy to talk about this stuff with you. If you need a few minutes offline, that's fine. If it's challenging, but I would say practice this on yourself at least 3 or 4 times and try acupressure on somebody else as many times as you can. Again, I know with COVID, some people are more isolated than others, then just treat yourself, or at least like work it out like on a pencil and paper, right? And then if you want my feedback, to say, hey, text me a screenshot or text me a picture on your phone, say, hey, I worked through this thing. Does this seem right to you? Happy to give you feedback. All right. All right. Have a great week, everybody.
Thank you.
Thanks,
Be well.
Tom.